Enjoy a thrilling presentation on everyone's favorite topic, charting and documentation. Please welcome Doctors Jack Stevens and Kevin Stephanoff.
Woo!
Did you get a clicker? I didn't get a clicker.
My fault.
Good morning, I'm Jack Stevens, and I'm the CEO and founder of View Behavioral Health. We have 3 psychiatric hospitals in Southern California, 79 beds of adult in Long Beach, 52 beds of child adolescent in Colton, and 72 beds of adult locked psychiatric hospital in Colton. And for about the last 9 months, we've been working with Psynk AI, which has helped us develop a tool for streamlining and improving the quality of psychiatric documentation. And as it's evolved, we've seen just how much it improves the quality of what it is we do. In just a minute, I'm going to introduce you to Dr. Stephanoff, Kevin Stephanoff. He's the medical director at Ocean View and has been the driving force behind this AI innovation. As an administrator, and I know some of you probably, or most of you may be psychiatrists, but as an administrator, one of the biggest challenges is getting the psychiatrist to thoroughly document everything that you need them to document in order to get paid. And it's not the psychiatrist's fault, it's that it's difficult to grab this lab result or this behavior that happened overnight or that thing and have it all be in one place at the same time. Psynk AI brings all that relevant clinical information to one place, and when the psychiatrist interviews the patient, it's all right there. So as they ask those questions or review different aspects of the patient's care, it's all right in front of them and they don't miss anything. And they get it done in a tenth of the time that it takes to sit down and write notes, depending on how fast you write or document. So, again, we talked about some of the improvements. 40 to 50% of psychiatrists' time is spent doing documentation. And there's a tremendous amount of pressure on psychiatrists to get that documentation perfectly right in order for the facility to get paid. What ends up happening is the poor documentation is a resource drain on the hospital because we have a full UR staff, and as those of you that are psychiatrists that do inpatient practice know, you feel like you're being stalked by the UR team, right? Because they're always like, give me more, give me more. This system streamlines that, so you're essentially working with the UR team and producing exactly what they want, and you will get like 0 or a very few nagging calls if you use the system. So, I'm going to now introduce Dr. Stephanoff, the question here is, what would you do with 2 extra hours back every day? Obviously, you could see more patients or just spend less time on activities that aren't billable. So, again, you see this from this slide, there's real-time capture of a structured note at the point of care. The billing ready documentation pre-claim is set up. Medical necessity and coding is provided. So it drives medical necessity and active treatment documentation. And it pushes it in front of the psychiatrist, so it's easier for you to document that. And so then we have to, as a lot of you know, it's easier to get it right the first time. It's very inefficient to go back and have to redo things over and over again. So yeah, this actually makes it so you get it right the first time. Okay.
Thank you. So I'm Dr. Kevin Stephanoff, as he introduced me. I'm the medical director at Ocean View Hospital in Long Beach. And I've had the pleasure of working with Psynk AI for about 9 months. So it's very much transformed my workflow. And so I'm here to show how it looks on a daily basis, how it transforms my workflow. And since I'm medical director, I also have coordination with the administration, so I see how it helps them as well and the interaction between the two. And I think a lot of times when we think about AI in psychiatry, what we're thinking about is text to speech, or speech to text rather, or a scribing system. But we do way more than that, and it's just transformed the workflow of the hospital. And so I'm going to give just a brief overview of what it looks like for me on a day-to-day basis here. And what I'm not going to touch base on, because we don't have time, is how it affects our nursing, which also uses the social worker, utilization review, our treatment team, billing, across the entire hospital. We get benefit from this. So I'm just scratching the surface of where it actually benefits me. So I'm going to contrast what it's like at another hospital where I don't use this versus the hospital where I do use this. So traditionally, just beginning the day, it ends up being chaotic. I'm not oriented to anything. Like tomorrow when I get to that hospital, I'm going to go get a paper census from the intake department. I'm not going to have any situational awareness. I don't know if those patients are actually in those rooms. I don't know who's severe. I have to coordinate with my nurse practitioners and my physician assistants to text them. I have to tell them who they're going to see, who I'm going to see. The day already starts off completely chaotic. So let me tell you a better way that we deal with Psynk AI. So first and foremost, I have my critical tasks that need to be done. So firstly, things like legal holds or pending discharge summaries. I have my list of things that need to be done, and I can quickly go through those and accomplish all of the important tasks for the day. And I have a live census. So what's great is this will link to any kind of EMR, Cerner, Epic, anything else that's out there. And it'll have a live dashboard. So if a patient moves rooms, this will be updated. Of course, I can sort by room number, admission date, etc. And very quickly, I can also assign my mid-level. So if I have a nurse practitioner seeing some patients, if I have a PA seeing patients, I can quickly assign it. And my notes never get lost. I know exactly which notes are pending for the day, which ones are in progress, and which ones are completed. So I'm not having to think, what needs to get done. All in one place, I have this dashboard to get everything done. And what's really helpful is as soon as I come in, I have situational awareness. I have patients that are color-coded by severity. So we have patients that are red, yellow, and green. So the red patients are patients that have severe symptoms over the past 24 to 72 hours. Auditory hallucinations, suicidal thoughts, acting erratically. So again, when I come into the hospital, I have situational awareness of who needs to be seen, the patients I need to prioritize first. And sometimes at my old hospital, I don't even know what my patients look like when I come in on a Monday. Here I've got pictures. And I know this maybe you can find it in a different place, but what's nice is everything is in one place, one dashboard. I have total awareness as soon as I enter the hospital. So the benefits for the doctors is you have this dynamic census, it's updated immediately, it coordinates with the EMR. I have immediate clarity on assignment, so if I'm working with nurse practitioners or PAs, I'm not trying to text them, I'm not trying to call them, it's very easy to assign work to everybody. I know my patients, I never miss an assigned patient. From an administration standpoint, providers will not miss patients, they will always get their notes done because of that. You don't have a bunch of coordination, you don't have to have a paper census, it's very easy to just have doctors start the day. Now the next part of my day is the legal compliance. So the way this works at my other traditional hospital is I have to figure out which holds are expiring, which means some staff member has to track it, inevitably they miss some. I have to go get a paper 5250 or 5270 form or a REIS petition. I have to find the chart, I have to fill it out. It's often illegible because I don't write so neatly. When I give it to the nurse, they might lose it. So again, it's chaos from the very beginning. So let me show you the better way that we do it. So it starts first with just capturing the 5150 information. We have three ways of doing it. You can dictate it, you can type it, or we have image capture, where it'll just bring all of that information in, and that will then follow the patient all the way through hospitalization. So from the very beginning, very minimal effort. And then we can track expiring holds. So I'm being warned of every hold that will expire by 8 a.m. the next day, or over the weekend, it'll tell me all the way up until Monday morning at 8 a.m. So I can make sure I get all of those holds ready over the weekend. So again, I'll never miss a hold. And then I can batch them back to back to back. So it's extremely efficient. I don't have to click into individual charts. I don't have to go through all of that. I can do one after the next, after the next, after the next, and just get them all done really quick. And then they're AI generated. So it'll pull in all of the demographics. It will read my notes and know exactly the criteria by which the patient should be held in the hospital. It'll read all of my notes, not just my notes, the social worker's note, the nursing note. It'll bring all of that in here and write the entire hold for me. Now, of course, I'm going to go through and I'm going to check it, make sure I agree with it, but usually it's done well. There's very minimal work that needs to be done. And then I can execute an e-signature. One click, done, e-signed. ready to go. You now have a PDF that can now be automatically faxed to the court. It can be sent with the firearms advisement and everything that nursing needs just exported easily in PDF form. They never get lost because we have them in PDF form. And then we have the automatic hold reminders. So you have that dashboard in the beginning that tells you about all the holds that need to be done. But if for some reason you still didn't get it done, it will warn you in your progress note. Again, there's no more days when you're missing holds. You will be warned. There are fail-safes before you submit your notes, and you will always get that hold done. You don't even have to think about it. It's incredibly easy. So from a doctor standpoint, you never miss a hold. You can always be sure you'll get it. Sometimes also we have doctors, including myself, who sometimes forget a hold, and then you're at home and you get called by nursing staff. We need this hold. You got to write it. You got to fax it to the hospital. It's totally annoying. Here you just go online, go to the Psynk AI interface, done, sent to the hospital, easy peasy. No more illegible handwriting. And you're reminded so you never forget a hold. I know this is a massive problem at hospitals, and it's a compliance issue. So the benefits to administration, again, never have a missed hold, ever again. The holds are stored electronically. We don't have them lost in the chart somewhere. At one of my hospitals, they have one dedicated person that all they do is track these holds. The AI does it all for you, so it's reduced burden for the administration. And then for things like REIS petitions, for things like LPS conservatorships, we have all of the same functionality. So it's incredibly easy to do any of these legal things that you need to be done. So now let's talk about chart reviews and handoffs. So like tomorrow morning, I'm gonna come in on Monday, and I gotta figure out what the heck happened with my patients over the weekend, or maybe I'm covering for a doctor. So traditionally how this looks is, I often don't even get a handoff, or if I get one, it's not very good. I come in oftentimes blind to a patient. I don't know what I'm walking into. So let me show you the much better way we do it with Psynk AI. So it starts first with just having everything in one location. So I will start by opening up my progress note. And if you notice, there's already going to be information in the progress note. And what that is anything that occurred that's relevant to my progress note is already being pulled in. So if the patient slept 3 hours last night and they told the nursing staff, that is pulling into my sleep section. If they got agitated, required PRNs, whatever, all of that information is already being pulled into my progress note. So I don't have to chart review in a bunch of different places. It is all in one place where I'm going to interact with the patient. Everything is in one location. So anything critical that happened, it's right there. Of course, I can track medication history. So for example, if I'm picking up a patient that another doctor has been working on, I don't know all the meds that they tried. People tend to be bad at documenting that. So I can quickly review what are all the medications that were trialed, why were they discontinued. Of course, I know the PRNs that were given, I know the medications refused, and it's all in this one interface with the progress note. So all of the information I need is right there. And then if I want to go into more detail, I can go to a patient recap. So this is more of a traditional handoff. We have a blurb about why the patient came into the hospital. We have awareness of where they are in their legal status. You know how many days are left. You know the clinical events over the past 24 to 72 hours. So have they deteriorated? Have they improved? What are the symptoms? So you have in less than 30 seconds, you have awareness of exactly what's going on with this patient. You also have a very nice medication timeline. So you can see if it's another doctor, what exactly have they been doing with the medications over time? What side effects are we looking out for? What pending labs do we have? So again, all of this gives you full awareness of your patient, either coming back on a Monday or covering for another doctor. We also have the discharge plan. So it's reading the social worker's notes and the discharge planner's notes. It's looking at those conversations and pulling it in. So again, if I'm covering for a doctor, I already know what have they been talking about with discharge plan. I can already be so intelligent talking to the patient, knowing exactly what the context is here. And if I want more information, the AI will uncover hidden patterns, things that I might not think about. They're right there. And if you want to go really deep, we have a deep analytics tab. I don't have time to get into all of this, but if you really want to dive deep on the patient, look at trends and all sorts of deep analytic data, we have that as well. Of course, if you don't want it, you don't have to take it, but it's there if you want it. So the benefits are you never have to see a patient unprepared again. You never have to go in blind. You don't need to do a bunch of chart review. You don't have to go click into different charts. In 30 seconds, you have it all in one area, everything you need to know about the patient. You'll never miss overnight events, PRNs, medication refusals, anything like that. You have deep analytics. You know their trajectory. You know their adherence, everything like that. So all of the process of the patient since admission. From an administration standpoint, you have much higher quality documentation. You don't have doctors coming in not knowing who the patient is. You're going to actually be able to continue care. I know a lot of the problems are on the weekends, care tends to stop because the doctors don't know the patient. They just kind of continue things. Now they can be fully oriented to the patient so they can continue that care even on the weekends. And then, of course, we have these analytics as well. So let's talk about the actual patient interview itself. So what does the traditional workflow look like? Well, I'm either memorizing what they're saying, I'm jotting it down on a paper, maybe I'm typing it. Either way, I'm not making eye contact, I have split attention with my patient. I have to hope I remember everything. I hope I document acuity properly. If I have to get collateral, I have to do that at some point. I have to document it. At some point, finish my note. It's kind of a nightmare. So let me show you the much better way that we do it. So we get consent from the patient to record. And of course, if they don't give consent, we can still use the same interface. You can hit a little dictate button, and afterwards you can dictate. So you can use the system either way. And then, of course, as I'm talking to the patient, it will have a live transcription. So along the top of the note there, you can see exactly what they're saying. I've even had times where I didn't even understand what the patient was saying, but the AI actually understood, and I was able to read the transcription and actually have a better interaction with my patient. And of course, it's filling out the note live as I go. And I can skip redundant questions. I can't tell you how many times I've had patients come in and saying, I've answered that question 3 times. Why are you asking me that question again? So when a patient does an intake, and let's say that they've done a nursing assessment, I already know how they've slept, if they're doing drugs, what their social history is, all of that. I can now dive deeper into things that are actually relevant to my conversation instead of covering the same things that the patient has already talked about a bunch of times, which also makes the patient a lot happier. I can capture collateral immediately. So I can record the phone call. I use this a lot with child and adolescent. I talk to the parents. It will summarize everything that we talk about. So I can be busy working while they talk, and it'll just fill it right in my note. And if you remember earlier, we had these patients who were color-coded by severity. Now, when I click on the patient itself, the reason why they're severe will also be read in the chart. So I know, is this because of suicidality? Were they agitated? Were they not sleeping? So it's very clear from my note why they were severe. And so I can focus on that. When I'm done, I can actually verify the full transcript. So I can read everything that the patient said to me. A lot of times I've had disputes where patients said, I did not say that. I can actually pull up a transcript and I can review that. And additionally, if doctors, let's say, miss for some reason why the patient is severe, let's say that they were suicidal overnight, they were read, but for some reason the doctor missed that, they will actually get a warning in their notes saying, you did not talk about this very important thing. So again, we just have many fallbacks just to make sure we're doing great work every single time. AI also makes suggestions, and these are non-intrusive. So things that if you want to maybe change your mental status examination, if you want to consider a different diagnosis, if you should do something different with medications. Again, non-intrusive, if you don't want it, it's not going to bother you, but if you want it, you can dig deep and have all of those AI suggestions there. And of course, I always export my note by the time I leave the patient's room. So my documentation is done, and it is stellar documentation. So not only am I getting it done fast, but it's incredibly high quality. So from the patient interview, the provider benefits, again, very easy, get full attention to the patient. The system will actually, it's designed specifically for psychiatry. So this is not a system for all medical fields, and we're just applying it to psychiatry. This was designed by psychiatry for psychiatry. So it's listening for acute criteria. It's quoting those patients when those criteria come up. Patients are non-cooperative. You can still complete your notes. You get the AI suggestions. And of course, you have defensible notes and you have a transcript. So when the patient maybe disputes something later or their family disputes something, you have all of the backup there. The administration benefits are higher patient satisfaction because the doctors are actually engaged in the conversation. They're not splitting their attention. You now have consistent documentation across all providers. You don't have some that write good notes or bad notes. The notes look the same across providers and they're all very high quality. You also don't have incongruent nursing notes and doctor's notes. I've heard this complaint a lot from insurance companies where they'll say, the nursing note says the patient is suicidal, the doctor's note said the patient is not suicidal. Now we're pulling in that information from the nursing note and we're juxtaposing that to what the doctor says. So side by side, you're even showing that there's different reports from the patient to different providers. Notes are submitted before leaving the room, so it's faster to bill for the services because these notes are in immediately. Now, patient discharge. What does the traditional workflow look like for patient discharge? So number one, dread this task because it's miserable. We hate it. It's not fun. You have to remember the things that happen. Sometimes we've had patients in the hospital for, I've had them for months at a time, 9 months. You've got to recall everything that happened. God forbid you got to take over for another doctor who's had a patient for 9 months. They usually don't document everything that's happened. You've got a chart review. It's a nightmare. It's not fun. So now we eliminate the discharge dread. So I just click one button, boom, discharge summary is basically done. It's going to pull in all of the information about their follow-up from the social worker. So where they're going to follow up. It's going to pull in, of course, all of the meds. It'll pull in everything you need. And what's beautiful, it also writes the entire history of what happened with this patient. Let's say they were sent out for medical clearance. We're capturing that. Something happened with the lab result or a medication change. It's capturing that. And it's not just reading the doctor's notes. It's reading the recreational therapy notes, the social worker's notes, everybody's notes, the nursing notes, to show a robust history of exactly what happened with this patient over time. And of course, we can have templated information in there for risk management, so we're demonstrating that the patient can be safely discharged from the hospital. So the provider benefits, again, you don't have to remember what happened. It's so easy, especially when you cover for another doctor. That is such a nightmare. It's so easy now. The AI goes back, reviews all the notes, generates it right for you. You can review and submit it. It usually takes me less than 1 minute to do a discharge summary, usually even less than 30 seconds. So it's painless, and it's an excellent defensible discharge summary. The benefits from the administration are you have faster completion. We typically have 14 days to get this. I have so many doctors, unfortunately, who are just late and they take forever doing it. Because it is so easy, doctors will get it done and compliance just ceases to be an issue. You have stronger risk documentation. So if something adverse happens to the patient when they discharge, you will have a defensible progress note. You have much higher quality notes overall, and they're not delayed. So again, you can bill accordingly. Now let's talk about insurance review. How does this look traditionally? Well, I have got to hope that I've documented acuity effectively. Usually UR is not happy and they go, document better, you're not demonstrating acuity. It's going to go to a peer review, then you've got to be prepared to do a peer review with the insurance company. So let me show you a much better way that we do it with Psynk AI. And it's about getting ahead of it ahead of time. So remember, we're going to quote anything acute for this patient. This thing is geared towards psychiatry. It knows the acute criteria. It will quote the patient. It will bring in everything relevant, not just from your notes, but from the entire notes in the hospital to make sure every single note is demonstrating acuity. So you're accurately able to bill the complexity that's appropriate for the patient, even if the patient denies everything to you. I've had so many times where the patient is running wild on the unit and then they put on their best behavior when they speak with me. Traditionally, my note would indicate the patient's doing just fine. Now my patient is showing me accurately what the true acuity is of this patient, and it juxtaposes it to how the patient presents to me. And of course, insurance companies love to flag things. If you don't change meds for 3 days, they love to start denying your claims. And so we have an automatic warning. Doesn't mean you have to change meds, just maybe give a justification of why you haven't changed meds. Again, this is prophylactic. This is getting ahead of insurance reviews, getting ahead of denials before they start. At one of my hospitals, we have somebody who's dedicated to making sure doctors are changing meds every 3 days. Again, it's a waste of energy. The AI does it for us. It's wonderful. And then really what's incredible is this giant set of paragraphs you have. We have this generating justification for medical necessity based on CMS criteria across 8 criteria listed by CMS. So things like inappropriateness at a lower level of care, the necessity to follow labs, etc. So every single note, from an intake note to every progress note, will have a uniquely generated, fresh, everyday justification for hospitalization. So again, we're prophylactically getting ahead of these insurance reviews. We make it very hard for the insurance companies to deny claims because they have to contend with all of this that we've written up. And again, it's drawing in information from the entire hospital to get ahead of that. So the benefits to the provider, get ahead of the insurance reviews, the denials. When you have a peer-to-peer review, you already know what you're going to talk about. It's already written up in your notes. And you have a much stronger case to be made. You also have those automatic hold reminders. So if you're not changing meds as frequently as they like, it's automatically reminding you. From an administration standpoint, this is huge. Every single note from every single doctor, every single day, maximally justifies hospitalization. So this is maximizing the ability to get those claims paid. And they're available for immediate submission, so you're not waiting to submit claims either. And so you just have generally fewer insurance reviews. So I don't have time to get into everything. We're running out of time here, but I just wanted to briefly touch on some of the other things that we're doing. So we have this interdisciplinary board. I feel like treatment team meetings are often so long, they're tedious, they're stale after an hour. So we have this AI-powered interdisciplinary board where the doctors can talk with the discharge planners and also get input from utilization review. So if this is an all medical records case, or we need extra documentation or something, we can communicate extremely efficiently and make treatment rounds extremely efficient. We also have billing services. So this already has all of the notes that can be submitted, it knows the billing codes, everything is built in. And everything that I talked about for the benefit of me also applies to nursing, all of their workflow, all of the social workers. So now instead of the nurses spending time sitting there doing documentation, they can actually be on the floor. They can be face-to-face with patients. So all of the same benefits that I talked about also apply to nursing. So again, this is just a quick summary of a lot of the benefits. I'm only scratching the surface of it. So please come by our booth. We are Psynk AI. Thank you very much.